At this point, I would like to invite Dr. Margaret Chan, Director General, World Health Organization, for her welcoming remarks, please.
Thank you very much. His Excellency, Mr. Aso, Deputy Prime Minister and Minister of Finance of Japan, Professor Takemi, President Jim Kim, Excellencies, distinguished ministers, representatives of development partners and civil society, ladies and gentlemen. A very warm welcome to all of you to this high-level ministerial forum on universal health coverage. We are looking at universal health coverage as an instrument for sustainable and equitable economic growth. Mounting evidence tells us that investment in health, especially when they aim for universal access to quality services, contribute to poverty alleviation and share prosperity among nations. I thank the government of Japan and the World Bank for organizing this event. The Japan-World Bank Partnership for Universal Health Coverage, has supported case studies of health reform in many countries and emphasizing health financing, human resources for health, and the links between health and the wider economy. Yesterday, you heard about experiences in 10 of these countries, representing the wide diversity of settings. Today, we will focus on extracting lessons from these experiences. There is no universal model or pathway to universal health coverage, but experiences from one country can be highly instructive for others facing similar challenges with similar ambitions. Country experiences also yield an impressive range of policy options, reinforcing evidence and arguments set out in the 2010 World Health Report on health system financing. You will hear about the work and views of development partners and civil society, another vocal and articulate partner in supporting UHC. I thank civil society organizations for their recent and compelling call to action on universal health coverage. Japan is likely the best possible host for this event, and I want to thank you. Japan was an early achiever. Japan has established an effective guarantee of universal service coverage, as you have heard from Professor Takemi, with financial protection in 1961, and giving virtually everyone access to preventive, curative, and rehabilitative services at an affordable cost. That achievement was part of a deliberate effort to foster social cohesion and human security. In Japan, everyone is required by law to have health insurance, and fees are strictly regulated by the government to keep them affordable. UHC is not cheap, but it is affordable when the right policies are in place. Again, Japan provides an excellent example. Government per capita spending on health in Japan is lower than the average among all the OECD countries, and about half of what the US spends. At a time when health costs are soaring in many countries, Japan's tight regulation of the health industry has kept costs in check. A recent study summarized Japan's health system very well, and let me quote, "Good health at low cost with equity." That is truly a commendable achievement. I also would like to take this opportunity to thank His Excellency Prime Minister Shinzo Abe for his Lancet commentary with its strong support for universal health coverage as a post-2015 strategy. His articulation of the 3 global health challenges that can be met through UHC makes compelling good sense. And this is a kind of high-level commitment and leadership that can, lead the world in the right direction. The World Bank, of course, I'm so happy my very good friend Jim is here. The World Bank is an equally valued partner also for WHO. And we are working hand in hand and shoulder to shoulder to extend technical and financial advice to the growing number of countries that have made universal health coverage the goal for health systems reform. We have jointly held consultations with ministers of health and ministers of finance, and we have jointly conducted training courses in countries. This partnership, close partnership between WHO and the World Bank, sends a very strong signal that UHC is financially feasible and makes good economic sense. Health officials, I was told, health officials are always encouraged to know that we are working together so well. And I suspect this collaboration gives, especially ministers of health, some weight in terms of their arguments when they approach their ministers of finance. So Jim, we need your help there. And we have very good reason to anticipate that UHC will have a firm place on the post-2015 development agenda. Today, you will hear a status report on what WHO and the World Bank are doing to establish a framework and indicators for measuring progress towards universal health coverage. Monitoring progress towards UHC means monitoring social equity and shared prosperity. In fact, UHC is the ultimate expression of fairness. People who cannot afford to pay for health care are not left behind to die or to stay sick. None of those options is attractive. Again, a very warm welcome to all of you. The outcome of this unique Japan-World Bank partnership and the diversity of experiences within countries will help guide the way forward as we move towards the post-2015 development agenda. On that, a very warm welcome again, and thank you.
Thank you very much, Dr. Chan.